Hi, I'm Dr. Alex Ritza. I'm a chiropractor practicing in downtown Toronto at Park Road Healing Arts. And this is Lunch and Learns with Dr. Alex, and we are at episode 2. And while we are not so live on the Facebook, I hope this video is going to be really valuable for anybody that has numbness and tingling traveling from their neck into their hand. We talked a little bit in episode 1 about why numbness and tingling happens in the body, and here for episode 2 we're going to give you some solutions to help manage it. So I've got a couple props here. I went to town with my Crayolas and I've drawn some nerves on my hand, and I also have a nice piece of string. So in video 1 or episode 1 we talked about how a lot of numbness and tingling is a result of a core issue with the neck where there's some compression or stress on the nerve. And so a really good solution for this for home care until you're able to get into the office is doing what's called some nerve gliding or some nerve flossing. And so our little string here is our nerve. And the idea is that we're going to try and get a little bit more movement of these nerves as they travel out of the neck and into the arm through the really tight path through all of the muscles until they get down to the little fingers. So you can see here, if you get numbness and tingling in the green spot, that's your ulnar nerve, and that means somewhere along the way your ulnar nerve is probably being compressed, or it could be coming from the neck. If it is your blue nerve, that's your median nerve, and it's usually on the palm, and that's what's affected with carpal tunnel. And if it is your red nerve, that's your radial nerve. That travels down the back of the arm and goes to the thumb and the first, second, and third finger there on the hand. So the idea with the nerve flossing is we're going to try and get our nerve to slide a little bit between the neck and the hand. So what we do not want to do, because there's a problem with the nerve, is stretch it. So we never want to make sure that the neck and the hand are far away from each other, because if they do that, and like that, you can see the nerve has a lot of tension in it through the string. What we want to do is make sure that when the neck moves one way, the hand moves with it, so that you get this gliding motion. And some scientific studies have shown that said nerve can move about 1 or 2 centimeters back and forth through the arm, which can help it slide and glide a little bit better, so there's less stress and pressure on it from some of the tight muscles and core issues in the neck, and you get less numbness and tingling in the meantime until you can get in and get it seen. So first we're going to talk about the ulnar nerve. So ulnar nerve here is in green. It leaves from C6 and C7 in the neck, C7 and T1 in the neck, the lowest part. And for the ulnar nerve movement, for the nerve floss, what we're going to do is we're going to put it into a bit of a waiter's carrying position like this. So if I was to bring my head like this, that's going to be a full stretch of the ulnar nerve, which we don't want because you'll get more numbness and tingling. So the idea is that we never want to be here. We want to have at some point a little bit of break so that if the hand is this way, we can have that near stretch position in the arm. And so what we're going to do is we can bring the arm down like this, and now the head like this, and that's going to cause a little bit of gliding. And then when we bring the head like so, and then back into our waiter's position, that's going to drag that ulnar nerve up towards the hand. And if we're able to relax the hand and bring the neck this way, that's going to drag the nerve, the ulnar nerve, back up to the neck. So in real time, it'll look like this. Really exciting stuff, but actually really effective if you have an ulnar nerve issue, which again is that green nerve in the hand. So that's ulnar nerve. Now we're going to go on to the median nerve. So the median nerve travels down through the neck, kind of moves in through the pec in the front of the arm, under the bicep, and it comes straight down the hand, which you can see in blue. So to get a really good stretch of the median nerve, it's going to come back like this with extending the hand. So what we're going to do, same idea. Hand's going to extend back. We're going to bring the neck towards the hand so we don't get a full stretch and pull on the nerve. And in this case, arm's going to come in, neck's going to move this way. Neck's going to move this way, hand's going to move back. And if you get some guidance from a chiropractor or myself, you can get kind of creative with this based on where maybe the entrapment or the problem is. I usually like to keep it pretty basic. I usually focus a lot on the neck because that's where I find a lot of people's core issues are. But let's say that you had the core issue was underneath the bicep and it was getting trapped there. You can mess around with maybe just moving the ulnar nerve or the median nerve at the bicep, and that would look like instead of looking like this with the arm, we're going to keep it in that position, and we're actually just going to move the elbow. So if it was an elbow problem with the median nerve, which would need to be diagnosed, it would look like this. So if you have some guidance and you know your nervous system anatomy really, really well, i.e. you're a doctor, a physio, or somebody has told you that, then you can get really creative. The final one is the radial nerve, so here in red. So to get a full stretch of that is going to kind of go into a waiter's tip position. So like I'm kind of asking for that little tip back there. So in this case, go back into our waiter's tip position. The head comes forward so we do not get a full stretch. And then we're going to relax the arm. Hand comes forward like so. And the head comes that way. And then the head comes like this back so we don't get a full stretch. And we go back into our waiter's tip position. Now, I'm being a little blocked by the table. If you can see, I could just bring the palm like that, and that will take out the stretch just in the forearm of the radial nerve. And then I could bring the head this way. And then I can bring the head this way and stretch the radial nerve back. And again, if you get some guidance, if you find out that, say, your problem with the radial nerve is in the back of the shoulder, which it is for a lot of people to sit in a desk space, you can get kind of creative with that. So with the radial nerve, you come back into that waiter's tip position, and then based on your symptoms and what your doc might tell you, you might fool around with moving the arm at the shoulder and seeing if you can get a little bit of glide there. Now, a real big key with all the nerve flossing and nerve gliding is, again, we never want that string fully stretched out, because if we do, it's going to bother and irritate that nerve, and you're going to get more numbness and tingling, and you might make your issue a little bit worse. So we just want to get a little bit of glide, and we do that by making sure that when the hand moves in, the head moves away, and vice versa. I hope that was really, really helpful for anybody that has numbness and tingling. If your nerve is that irritated that you do have it, I really recommend that you get in and see somebody before it becomes a bigger issue. Episode 2 in the books, and I look forward to seeing everyone for episode 3 on the Facebook next week. Thank you.